Hey there, I'm Aditya and welcome to Digital Health on Air. I'm joined today by Terri Couts, the visionary leader and technologist, who's also the SVP and Chief Digital Officer at the Guthrie Clinic. Terri is well known in the health IT community for insightful perspectives and the impact of her work at Guthrie. So it's an incredible privilege to have you on the show today.
Thank you.
So why don't we start a little about your story, how you came into Guthrie, how you kind of moved into this digital role, kind of your path to becoming I think well-recognized leader in the health IT space.
Sure. So I'm a nurse by background, critical care, did a fair amount of time as a pediatric cardiac nurse. With that came a lot of call. We were on call for about 25 days a month. And, that really doesn't serve well in a work-life balance, particularly when you have young kids. And so somebody told me to get into this Epic space. I was working at the time at Akron Children's Hospital. And we were getting ready to implement Epic.
Mhm.
Epic did not have a lot of pediatric content, so they were looking for clinicians to actually help implement Epic and interviewed for the role. Didn't understand what I was getting into, but wanted to change, and so I took the role and started implementing Epic. From there, I went into consulting. Meaningful Use had kicked up, and
Yeah,
really
sure.
for a lot of that. And I learned a fair amount about how other systems work. Got grew in my role and continued to grow in leadership. Held all kinds of different leadership roles from New York Health and Hospitals to Iowa Health System, which is now Unity Point, and was ready to get off the road when I got recruited to Guthrie. Guthrie needed a VP of clinical applications.
Sure. A critical
And
role in any large like IDN type of system.
yeah, they were really building out what IT would look like for a growing system. And so they were transitioning from like this kind of small mom and pop shop to having their first CIO, building out the structure underneath the support.
So is it part of like a transition to like professionalizing the IT function?
Yeah, exactly.
Right.
And so I joined Guthrie. Guthrie, I've been here 9 years now. Now I'm the CDO, but served in that VP as my first role. And Guthrie is an integrated health system. We have 6 hospitals, 3 in New York, 3 in PA, multi-specialty clinics peppered across the 10,000 square mile region. We have it's a primarily rural population. And we have home health, hospice,
Yep. Basically every service under the sun, right?
pretty much. We don't do transplants, but
Okay.
pretty much everything else we do have a flavor. And we do um, academic medicine as well. We have residencies. And so, we kind of punch above our weight class here and serving our community, but a pretty solid integrated system.
So I think one of the things, especially got in a context of your journey into Guthrie and kind of the growth of, to abuse that term, professionalizing IT in service of the delivery organization. I think one of the things that Guthrie's been really well recognized for is, Chime Most Wired Level 9, like Gold Stars 10. I see the honor roll from Epic in the background back there. So kind of talk to me a little bit, or I'd love to hear your stories of how you kind of decided and how the evolution of the ecosystem inside of Guthrie became like, we want to become this first-rate, top-class system in terms of our deployment of Epic, our deployment of IT.
Yeah. I mean, these awards are really roadmaps to kind of being better IT service delivery, right? So when I first joined, Guthrie was the first CPOE customer for Epic back in 2003. So they're an early adopter, recognized the need for technology. But when I joined, the use of that technology was pretty subpar. And they had a lot of physicians who were stating that they were leaving the organization because of Epic, which is kind of silly when you think about, you're going to go
Well,
spend
the broader
$1,000.
arc of healthcare, right? Right. Like that's
Right.
swimming
So
into the water.
yeah, so one of the first things that the CEO at the time challenged me with is I want Epic fixed. And the stars 10, the honor roll statuses, those were all things that we put in place from a programmatic standpoint that helped us be better IT delivers. our technology delivers. And it's really about enablement. And so we looked at all of the things that the capabilities that the system could do. We used the roadmap to kind of get us to a stars 10. We actually were a stars 2 when we first started. We got to a stars 8 within 7 months. And it was just around how do we make sure that we take care of all of the things that a provider needs to have, or a caregiver, and getting rid of all the stupid stuff, all the stuff. And so we put a conscious effort around that. That has gotten us to a stars level 10 5 years in a row. I think there's 3 other organizations in the world that have achieved that. And it's just really about putting the effort, having the importance around how does our caregivers use the technology.
Yeah.
Being a nurse by background, that's really important to me. Technology can either enable or it can prevent. It can be the barrier to providing good care. And so we
Totally.
put a focus around that.
I think one of the interesting bits in there was, this level 10 is like incredible. You don't hear it very often. But actually, the little nugget in there, which I think is maybe more impressive, is going 2 to 8 and 7 months. So there's probably like a real guided focus. And it sounds like from the CEO on down is saying, make this work for our teams. Like, I'd be curious to get like, what was the physicians and caregivers' reactions as you kind of made that 7 month like sprint, it sounds like.
Yeah, and they didn't necessarily know that it was a stars 8 or a stars 2. They just knew it didn't work for them. And
It
so
was just much more how they felt it
yeah,
worked. Yeah.
yeah, and how it impacted their day. And so we put we did a lot of listening tours. We listened to the things that were a challenge for them. We made a conscious effort to get closer to foundation, so making sure that we had
Yeah.
not a lot of customized build anymore. And we also made a conscious effort to not allow IT to be the decision maker on what we turned on and what we didn't turn on.
Oh, interesting.
And I think there was this theory that, oh, a nurse isn't going to do this, so I'm not going to work on this, but I'm going to work on this. And what we transitioned our IT analysts to do is we were really focused on, we're going to turn on everything unless there's a compelling reason not to.
Right.
And we're going to make sure they have the appropriate training to do so. And we did it in these sprints, sort of like what Epic does now with their quarterly updates.
Yeah, sure.
We were doing quarterly updates before Epic went to that.
Right, in terms of modernizing your build and making it
So
work.
we were bucketing things together so that the training was consumable, that they understood the why behind it, and we can monitor the utilization so that we can go out and support them if they needed additional support. Instead of having these kind of one-off things that were being put into production that nobody understood, nobody even knew was there. Maybe they didn't even need it anymore. There was all these things that were happening in the organization. We just put just some focus, some intention behind how we.
Yeah, as opposed to here's a random ticket. Let me just go turn this like feature flag or turn this feature on. So between when you kind of started and now, a lot of your focus has probably changed, right? And part of this, I think, is your transition to this chief digital role as well. So tell our audience a little bit about how the role has changed, what your focus has kind of evolved to after you kind of made it work, in your words.
Yeah. So, I mean, I still have the same traditional CIO responsibilities, but I think the role as a CIO has changed drastically in organizations. And one of the things that we wanted to highlight, particularly my CEO, my current CEO, was that, again, that enablement that comes with technology. And so by naming it the Chief Digital Officer, he wanted to make sure that we highlighted all the things that we were able to do and serve our patients from a digital lens versus, just a technology kind of being done to something.
Keep the lights on sort of stuff.
Exactly. And a lot of the things that we focus on is how do we care for our patients just a little bit differently through technology. A lot of people ask me, do you miss nursing? Do you miss patient care? And I'm still a nurse. I still provide patient care. I just do it a little bit differently. And I do it by allowing the technology to enable that care. And if, we needed to change our lens on how do we deliver that, and maybe think a little bit differently. It's not about implementation and walking away. It's about being purposeful in the tools that we use and how do we deliver that to our caregivers, and is it the right tooling? And so we've made a lot of change around that. And sometimes it includes AI, sometimes it includes automation, sometimes it doesn't. But Sometimes it's just reinventing how we've deployed it so that
Sure.
the usability is such that it actually enables that care.
I mean, I think that's a fascinating look at kind of what a very unique perspective that I've heard is like hosting various CIOs here around like the goal is actually I'm still providing patient care, right? I'm just not doing it through technology and delivery and kind of the Kaizen, like continuous improvement of this technology that's deployed. So can you tell me a little bit like maybe an example of like how you've evolved that? I think there's a bunch of innovation at Guthrie. I think the Pulse Center comes to mind. There's a bunch of different things, and love to hear an example of how that continuous improvement in the service of patients has been
Yeah.
delivered.
I mean, you have to start with the foundation, right? So we had to get our Epic. Our Epic was our biggest platform, right? So we had to get
Sure.
that
It's like the
right.
operating system of your health care
Exactly.
ecosystem, right?
And one of the outcomes of that was obviously stars 10, but another outcome was that we had 99% satisfaction on our Press scores from our physicians with technology. And so they were no longer leaving because of technology. Now, obviously you have attrition, but we actually
Point 0.1%. I think we can consider that a win.
but we have a 95% retention rate for our providers. There's a lot of different reasons, but technology was not the reason they were leaving anymore. So that was the foundation.
Right. So you basically went from a dissatisfaction driver to basically a satisfaction enabler.
Yeah. And so then we had to think about how do we serve all of our patients every time, every place, everywhere, regardless of where they needed it. We span 10,000 square miles, and obviously you don't have the same kind of care at each facility, but can
Sure.
we treat them similarly enabled by technology? And so some of that is with making sure that they had good tools. Some of that is making sure that we had telehealth and those kinds of services. But then, if you take that a step above, how do we make sure that our care is high quality care? So thinking about the Pulse Center, how do we make sure that every patient is covered from a fall risk standpoint? By centralizing that, we can do that. We can use technology to make sure that every patient, regardless of the hospital they sit in, can be covered from a fall risk standpoint through computer vision and some AMR functions.
Virtual fall monitoring. Yeah.
Exactly. And then you just kind of expand that out. And with our Guthrie Pulse Center, we took it on as a strategic initiative to say, how do we serve our patients differently? Shouldn't matter where you live, whether you live or die. That's something that my CNO says all the time. And so how do we make sure that we can expand that care? So we introduced, a virtual intensivist using technology to provide intensive care in some of the hospitals that didn't have 24-hour intensivists.
Staffing. Yeah.
And just that's how we're changing how we use technology. And it starts with making sure that our analysts and our IT staff are educators, helping our clinicians choose right technology. We're not the decision makers. We certainly have an influence. We're not going to put something into our environment that has cyber risk or something of that nature. But we're not the
But you're in service of the care teams, right?
exactly.
So I think for the
That
audience, the
partnership is
Pulse Center. Oh, sorry. Finish your thought.
I was just saying, it's that partnership, is that relationship that helps drive those kind of conversations.
It makes all the sense in the world. And where I was going to go is I think, the Pulse Center is something that while I've seen similar sort of setups, it's a novel set of terminology for that setup. So people who might not be familiar with kind of the central virtual command center kind of setup that you've deployed, can you tell us a little bit more about what is the Pulse Center, kind of what was the fruition that got it there, and kind of maybe some of the outcomes that you've had from it?
So the Guthrie Pulse Center is a centralized command center that literally is checking the pulse of our organization, which is why we named it the Pulse Center.
Good name.
It has virtual components like virtual nursing, virtual ICU, remote telesitters, those kinds of things. But it also has some operational components like telemetry monitoring, centralized. We have our bed placement and bed coordinators in the same space. We have our transfer center in and out. And the synergies of all of those in groups in one space really creates this unique department that allows us to be more transparent on what our resources are and how do we serve our patients. So if we have, instead of having everybody come into our main hospital ED and kind of bogging up our ED, how do we make sure that the right care is done at the right time? So by providing virtual intensivists, we're able to keep ICU-like patients in some of our other ICU beds. We're able to, make sure that they're covered from a telesitting standpoint. We have virtual nurses that allows our nursing staff to have a kind of a phone a friend and to, you know,
Get help as needed, right?
yes. And so, you know, the synergy within that space allows for a lot of different things, and we've seen the outcomes, but it did come with an initial investment and a vision to kind of get us there. There's a lot of change management that happened. We
That's, I was going to imagine, like this
yeah.
is a major operational shift in how the day-to-day business of Guthrie's run, right?
Yeah. And we would love to continue to expand that. You know, we would love to have centralized physical security in the same space. We would love to have centralized, you know, remote patient monitoring where we feed some of our home care stuff into a centralized space and have appropriate escalation. So there's not that question of who does what with what data. There's a process around that.
Right.
We're continuing to grow that. So it's been a 3-year journey. And we've seen some really good progress with that.
And it sounds like as you that last bit there, you're kind of expanding the purview of a pulse center beyond your typical like remote command center,
Right.
because like there's operational stuff. You're talking about like bed capacity utilization, but you're also like talking about RPM and like making sure patients have like a the right algorithm when something goes aberrant over there to manage that. Is kind of your vision to keep kind of growing what happens in the pulse center?
It definitely is. I think, you know, we started with the problem, the most important problem at the time. At the time, it was our virtual nursing staff,
Sure.
um, primarily because we had large traveler spend, tons. We had, you know, our
It's
most,
also kind of like the traveler spend conversations also of the era too, right? In that
it,
21, 22 timeline.
exactly. And
Yeah,
it did the COVID hit us a little bit later because of our geographic region,
totally.
patients that we serve, but it did hit us. And so we had a mass exodus of nurses. Our most senior ICU nurse was 3 years, which is atrocious because
That's
you don't
hard to
have that
believe.
intuition, those things that come as you,
Yeah, like the body of knowledge, the
yeah,
corpus of like experience and the value of that. 3 years is an incredibly, it's a hard number to believe, but you live it.
and so that's where we started because that was our most important problem. That's might not be the most important problem for other people, but that's where we started. And then we wanted throughput. We wanted to make sure we served all of our patients. Now we're really looking at how do we provide care in place? You know, so they don't necessarily have to come into our facility, but how do we
Yeah,
provide similar level of care and care in place? We're not in a region where we can do something like medical home. We don't have the nutrition services and some of those other requirements to meet those CMS those checkpoints, but we do want to push the envelope and say, how do we provide care in place? We're looking at even our long-term care facilities. How do we initiate care earlier instead of having them come into our ED and getting admitted, and then we can't get them back out? And some of that is being done through technology, and it's being able to feed into the pulse center and have a centralized location to be able to kind of control that data.
that's incredible. And one of the things I know you were named, innovator of the year, and clearly like this, there's a passion that underlines a lot of this that I'm getting out there. So let's maybe move to a little bit of advice for other folks. Like they're, young and upcoming, leaders, analysts, directors, executives who want to become health system leaders in the technology space. Like, how do they find that path that you found? You have a nursing background, but there'll be others who don't. There's people who have an innovation background or a problem-solving mindset. Like, what advice can you give to the folks who are looking to kind of continue to grow that career ladder?
I think listening is probably one of the biggest things that helps me in my career. So obviously I can translate the clinical language, but just understanding the things that they're challenged with. When you're using the technology every day, you just think that this is easy. Why aren't you doing it? Just push this button, and I don't know if you've ever had to support an elderly parent or something with
Certainly,
trying to
yeah.
figure out how to do something. It can be very challenging, but listening, because sometimes their issues are real issues, and we have to adjust on how either we deliver or train. Um, and I also think you have to be in that mindset of yes, but, or yes, if, not a no. And so how do we figure out how do we do care differently? And and that is a challenge in healthcare because we are such a risk averse industry.
Yeah.
And so you obviously you have to take the patient safety into effect, but
Cybersecurity,
yeah,
other things like
there's
that. Yeah.
lots of barriers, but how do we do it in a way that supports what we're all here to do? If you're in healthcare, you're aligned to the mission of caring for people.
Of course.
And so if you're not aligned to that mission, you're probably in the
Oh,
wrong role. And so
wrong industry, right?
yes. And so you have to listen, you have to understand. But I think also another big part of our role is change agents. We have to make sure that, we can push the envelope a little bit. We have to meet people where they are. I can tell you, even with our pulse center, I had a critical pulmonary doc that was in my office every single day, every day, telling me why it wasn't going to work, why this was not going to work. We needed 12 more physicians to do the job. It was not going to work. And after about 3 weeks of this, I finally said, what can you get on? Like, what can we start with? And then he's our biggest champion now. But we do have to meet people where they are. And sometimes, and that's the hardest work. It's
I
it's not deploying the tech, it's the change
I
management.
have a running joke here at Luma, which is software is easy, people are hard.
It is.
Right. So, but I think underneath kind of what you're saying was maybe a really interesting other tidbit for folks who are aspiring to be leaders in health systems, which is changing the narrative around, well, what can we do, right? As opposed to what will prevent us from getting where we want to go, right? Because at least hearing what you've done at Pulse Center and kind of some of the other stuff you're saying, no change is instantaneous, right? There's an incremental build on innovation, especially when you color in the risk-averse nature of healthcare. I'm curious for your take, just kind of, you built a foundation for building innovation in a kind of in a risk-afraid universe, right? Healthcare. In kind of where do you see that evolving in the next couple of years? How do you see that the next set of innovations coming now that you've done such a great job at building that foundation?
Yeah, I mean, I think, we can't ever stop with the kinds of services that we can provide in the Pulse Center. Of course, we do have to have measurements that we're trying to achieve. So you need to
Yep.
understand the why, you need to understand the problem you're trying to solve, all of those things that correlate into outcomes. I am really working on a data lake house that's been about 8 months in the works. I think once we have actionable data, not being reactive to data, is going to really be an accelerator to being innovative. Um, but I also think one of the things that we're really focused on is sort of this patient experience center. So how patients engage with us should be on their terms. Sometimes
Mm.
that's through a chat bot, sometimes that's through a call center, sometimes that's through our website, but the experience should be the same. And so we're really looking at technologies to help us with that. Um, I do think AI has its role.
Sure.
But it needs to be purposeful again and intentional on how you deliver that. But it is one tool in the toolbox.
I think this is like very refreshing that it took us till about 25 minutes in to even talk about AI. So I'm already a fan of this conversation. So Terri, thank you so much for spending some time with us this morning on Digital Health on Air. I think the lessons you had were both like growing into a clinic, growing into just not just CIO, but chief digital kind of role is invaluable for our listeners and honestly for folks who are looking to look at that thing, look at how to build a strong foundation and build on top of that. And your experiences here and clearly the innovation you've built at Guthrie is a model for how all health systems can kind of look to use technology to service their care teams and their providers, not just to provide technology for them. All right. Well, thanks so much. Look forward to seeing you next time.
Yeah, thank you.